I would like to invite our second speaker, Dr. Fotios Mpekris from the University of Cyprus, and he will talk about NC6300 nanomedicine, modulates tumor microenvironment, and improves the efficacy of immunotherapy.
Good afternoon, everyone. I'd like to thank the committee for giving me the chance to present you today our recent work. I'm Fotios Mpekris. I'm a research associate professor in the University of Cyprus. And today I will present you our recent study about the effect of ebirubis in mice cells, NC6300, and their effect in the tumor microenvironment to improve the efficacy of immunotherapy. First of all, a brief summary about the mechanical abnormalities in the tumor microenvironment that affect the drug delivery and thus compromise therapeutic outcomes. A crucial characteristic of the tumor microenvironment is the extreme desmoplasia, as high levels of cancer-associated fibroblasts are observed in the extracellular matrix, which creates a lot of collagen hyaluronic acid, which leads to development of forces that are applied to the intratumoral blood vessels and leading to the compression of blood vessels and hypoperfusion. Also, the proliferation of the cancer cells in a confined host space results to also the applied of forces to the vessels. Another characteristic of the tumor pathophysiology is the abnormalities in the tumor vasculature. Specifically, the absence of pericyte coverage and the large vessel wall pore size results to an increased fluid flux to the interstitial fluid pressure, which results to an increase in the interstitial fluid pressure. It is measured experimentally using the Wigging doll technique that the interstitial fluid pressure levels are close enough to the levels of the vascular pressure, which results to eliminate the pressure difference across the vessel wall and thus leading to no fluid flux to the tumors. Here we can see an animation where it shows that the heterogeneous perfusion in a tumor microenvironment. We can see some regions in upper right that we have the tumor are well perfused. There are some regions that the tumors, the perfuse is decreased, and there are some regions that we don't have any perfusion in the black area. The goal of our study is to employ different agents to target some of the extracellular matrix components or to restore the abnormalities in the tumor vasculature, thus to lead to decompression of blood vessels and improve tumor perfusion and drug delivery. The improvements in tumor perfusion can cause immunostimulation and decrease the immunosuppressive cells. In this study, in a collaboration with a nanocarrier company in Japan, which produced these ebirubis in mice cells, NC6300, and funded this project, ebirubis in mice cells, as mice that have a diameter of 60 nanometers, are approved by FDA and under in clinical trials for patients with sarcomas. In this study, we employed two different cancer cell lines, one fibrosarcoma, MCA 205, and the osteosarcoma K7M2. The protocol that we follow are presented in the panel A, where we weighed the tumors until to reach a size of 190 cubic millimeters, and we started the treatment of ebirubis in mice cells. We employed 3 doses of ebirubis in mice cells, 1, 3, and 10 milligrams per kilogram. The maximum tolerated dose for these mice cells is 25 milligrams per kilogram, and check the efficacy of these mice cells alone or in combination with anti-PD-L1 and immune checkpoint inhibitor. We observe that only the high dose of ebirubis in mice cells has an anti-tumor effect alone, but we observe that only but also we observe that the combination of 3 milligrams of kilograms with immunotherapy and 10 milligrams per kilogram with immunotherapy has statistical significant differences with the other monotherapies. Immunotherapy alone didn't have any effect. Also, we quantified the number of the mice that were responders. Was the mice that the tumor was stable or reduced compared to the volume when the treatment started. And we found out that only the combination treatments of mice cells with immunotherapy has a number of mice that were responders. As we observe that only in the combination treatments we have responders, we hypothesized that this effect is due to anti-tumor response of the tumors. We repeated the experiment using the high dose of epirubicin mice cells, 10 milligrams per kilograms, combined with immunotherapy or monotherapies alone. First, we investigated the effect of this treatment in CRT level, calreticulin marker, which is a marker that is associated with immunogenic cell death. Using immunofluorescence staining and quantification, we found out that mice cells alone or in combination with immunotherapy increases the levels of CRT levels. Also, we investigated if this immunogenic cell death caused by the immune cells is associated with the levels of effector immune cells. First of all, we checked if the knockdown of CD4 or CD8 cells can reverse the observed effects that presented from the combined treatment group. Before the treatment with epirubicin mice and immunotherapy, we administered the antibodies that block CD4 or CD8 for 2 days. And we observed that in the group where we blocked the CD8, the effect was restored. It's the brown dots, the fourth column. This suggests that the efficacy of epirubicin mice cells and immunotherapy is dependent on CD8 T cells. Then we try to identify the mechanism of the effect of epirubicin mice cells in the tumor microenvironment. First of all, we investigate if the epirubicin mice cells can induce vascular normalization by restoration of the abnormalities in the tumor vessels. We quantify the pericyte coverage with the marker of NG2 positive, and we find out that the epirubicin mice cells and the combination with immunotherapy increase the pericyte coverage. The pericyte coverage and the restoration of the abnormalities in the tumor vessel are associated with interstitial fluid pressure. Using the Wiggy-Nigdal technique, we measured in vivo the interstitial fluid pressure, and we found out that the combined treatment or the epirubicin mice cells can decrease the interstitial fluid pressure. Instead of the restoration of the tumor, of the abnormalities in the tumor microenvironment, also we investigated the effect in the extracellular matrix components. And if the mice cells can target some of the components of the extracellular matrix, decrease them, and decrease mechanical cells and decompress the tumor blood vessels. First of all, we quantify the levels of the cancer-associated fibroblasts and the proliferation of them. And we found out that epirubicin mice cells decrease the levels of the cancer-associated fibroblasts. Thus, the next step, we investigate if the decrease of the cancer-associated fibroblasts is associated with decreasing the levels, first of all, for the collagen, and then for hyaluronan. In both cases, the mice cells and the combination decrease the levels of these components of the extracellular matrix. Then we investigated if this improvement in tumor perfusion and drug delivery is associated with T-cell migration and proliferation. We assessed the level of CD3 positive area fraction of CD8 and the proliferation of CD8 T cells. In all the cases, mice cells alone or in combination with immunotherapy increase the T-cell migration and proliferation, suggesting that the mice cells can enhance the levels of effector immune cells. At this point, I would like to thank Dr. Triantafilos Stylianopoulos, the head of the Cancer Biophysics Laboratory, and the rest of the members of the lab that performed this study, the NanoCarrier company for the production of the mice cells and the funding of the project, and also the Innovation Center of Nanomedicine, which support with the analysis of the data and all the funding borders. and all of you for your attention. Thank you.